A census enumerator works his way down a crowded tenement street in New York City. The year is 1900. On his ledger, he marks down the details of another family crowded into a single room. He gets to be the youngest. A name and age, under 1 year. Just another mark on a page, soon to be compiled into a vast national portrait. That single mark joins approximately 2.1 million others just like it, a cohort of infants counted across the United States, a generation taking its first breath in a new century. But a decade later, when the census takers return, hundreds of thousands of those children will have vanished from the record. They didn't emigrate. They weren't simply missed in the count. They were gone. And for decades, the sheer scale of that disappearance remained a ghost in the national data, a statistical gap that nobody could fully explain. When you place the 1900 U.S. Census next to the 1910 Census, a disturbing anomaly emerges. The cohort of children born around the turn of the century is significantly smaller than it should be, even when accounting for the expected mortalities of the era. The gap is enormous, representing hundreds of thousands of lives that were recorded and then, statistically, erased. Where did they go? The first and most obvious suspect is a simple clerical error. The U.S. Census Bureau was, and is, a massive undertaking. Mistakes happen. Demographers analyzing the data did find some evidence of what's called age heaping, where ages are rounded, and noted inconsistencies in how infants were counted from one census to the next. The 1900 census, in particular, may have had a slight overnumeration of infants compared to other censuses. But these statistical artifacts, while real, account for only a tiny fraction of the gap. They are statistical noise, not the signal. The truth is far darker, and it was hidden in plain sight, obscured by the very way the nation collected its data. In 1900, the United States did not have a comprehensive system for tracking death. The official death registration area, the collection of states that kept reliable mortality statistics, covered only 10 states and the District of Columbia. This represented just 40% of the population. For the other 60% of the country, the data on who was dying and why was patchy at best and non-existent at worst. The true scale of the crisis was invisible in the national statistics. It wouldn't be fully uncovered until decades later, when historical demographers Samuel H. Preston and Michael R. Haynes went back into the census microdata. In their landmark work, Fatal Years, they solved the mystery of the missing children. They weren't missing, they were dead. Using cohort analysis to track the children from 1900 forward, Preston and Haynes calculated a death toll that is difficult to comprehend today. Approximately 1 in 5 white children and 1 in 3 black children born around the turn of the century did not survive to the age of 15. The statistical gap wasn't an error, it was a mass grave. To understand how this happened, you have to understand the world these children were born into. It was a world without antibiotics, without widespread vaccination, and for millions in burgeoning cities, a world of dangerously poor sanitation. Crowded urban tenements became breeding grounds for infectious diseases that were often a death sentence for the very young. Diphtheria, scarlet fever, measles, tuberculosis, these were the agents of death. But the greatest killer of all, especially for infants, was a deceptively simple illness, diarrhea. Known then as summer complaint, diarrheal diseases were responsible for a staggering number of infant deaths, especially during the hot summer months. And the primary vector for this disease was hiding in the nursery. It was the milk bottle. In 1900, most milk was not pasteurized. It traveled from rural farms to dense city centers, often unrefrigerated in unsanitary containers. Bacteria flourished. To make matters worse, it was common practice for distributors to dilute the milk with impure water to increase its volume, and then add chalk or plaster to restore its white color. To stop the milk from souring, some even treated it with chemical preservatives like formaldehyde. For an infant with an undeveloped immune system, A bottle of this contaminated milk was poison. The resulting diarrheal dehydration was swift and often fatal. In the poorest slums of New York and Chicago, during the summer, infant mortality rates could reach as high as 300 deaths for every 1,000 births. 30%. The missing children of the census were the victims of a system that allowed for the mass poisoning of its most vulnerable. This catastrophe was not going unnoticed by everyone. On the front lines, a new kind of public servant was beginning to fight back, armed not with ideology but with data. In 1908, New York City appointed physician Dr. Sara Josephine Baker to be the chief of its newly formed Bureau of Child Hygiene. It was the first government agency of its kind in the United States, a direct response to the city's appalling infant mortality rates. Dr. Baker approached the problem like an investigator trying to solve the highest murder rate in the city. She and her team used data to pinpoint the deadliest neighborhoods and focus their resources there. They established a revolutionary public health arsenal. Public health nurses were sent directly into tenement homes to teach new mothers basic hygiene and infant care. The Bureau created milk stations, dozens of storefronts across the city where mothers could get clean, pasteurized milk, ensuring a safe supply for their babies. Dr. Baker also created Little Mothers Leagues, training older sisters in how to care for their infant siblings. The results were astonishing. Under Dr. Baker's leadership, the infant mortality rate in New York City was cut in half, falling from 144 deaths per 1,000 births in 1908 to just 72 by 1923. It was proof that these deaths were not inevitable. They were preventable. While Dr. Baker was fighting the battle on the streets of New York, a larger war was being won at the federal level. In 1906, Congress passed the Pure Food and Drug Act. This landmark legislation created the predecessor to the modern FDA, and for the first time began the federal regulation of the nation's food and medicine supply. The law was a direct assault on the contaminated milk and dangerous preservatives that were killing so many children. It was a declaration that public health was a national responsibility. So where did the children of the 1900 census go? They didn't go anywhere. The gap in the census records is not a mystery to be solved. It is a memorial to be acknowledged. It is the demographic shadow of nearly a generation of children lost to preventable causes. The story is a somber one, but it is also a powerful testament to progress. The work of pioneers like Dr. Sara Josephine Baker and the passage of laws like the Pure Food and Drug Act began the process of closing that gap. They proved that data, science, and public policy could avert tragedy on a massive scale. The empty spaces in the 1910 census are a reminder of a fatal time in American history, but the children who appear in the censuses that followed, in 1920, 1930, and beyond, are the living proof that the lessons from that tragedy were finally learned. The gap was not an error in the books. It was a wound in the world, and the work of public health was to figure out how to heal it.